Rahul Menon for his talk on OCTA in AMD.
So, a very good morning to one and all. I'll be talking to you about OCT in AMD. So, OCT is a non-invasive imaging technique. Now, before compared to before, it has become a very routine practice in our day. Like every case of AMD, I would prefer to look at that OCT picture. Now, how does the CNVM look on OCTA? So, there are four patterns of CNVM. One, C-fan pattern. Second, Medusa head appearance. Third is the ill-defined pattern, and the fourth is dead tree pattern. So the C-fan pattern is when 90% of the membrane appears from one side of the lesion. Okay, and you can see the multiple capillaries and all this anastomosis on one side of the major vessel. The Medusa head appearance, just like the name, you will have a central vessel and the vessels radiating in all the direction from that side, and you will see the perilesional halo and everything, which I'll be coming across later. So the vessels will branch in all direction from the center of the lesion. Then you have the ill-defined, just like the name, it lacks a distinct membrane morphology. And then you have the dead tree pattern. So then the dead tree pattern, you have long dilated filamentous vessels with, you won't see much capillaries or branching over here. Now, of all the three patterns that I mentioned, the C-fan pattern, the Medusa head appearance, and the ill-defined, all these three are active lesions, whereas the dead tree pattern, it indicates chronicity. That is, there's no exudation there, so you don't have to go and treat such cases. So, how do we define activity in a case of CNVM from OCTA? So, whenever we talk about OCTA, there are two images that we are supposed to look at. One is the emphase image. We are mostly concerned with the emphase image. We don't, like, we go on the face value. There's also something called as cross-sectional OCT. So in the emphase OCT, you look at the branching pattern. So if you see over here, you can see multiple tiny capillaries over here. They will usually have a well-defined shape with tortuous lacy vessels. And in anastomosis, you will see multiple anastomosis and loops over here. Now, you also see this. This is the most important thing which I look in my OCTA in case of CNVM. That is the perilesional halo. Now, this perilesional halo is seen in the ORCC slab or the choriocapillary slab. So if you look at this image over here, you can see the CNVM here, and surrounding it is a dark lesion. Okay, you don't see much vessels or anything over here. This is the perilesional halo, and it indicates activity. Now, why do we see it as a dark region? There are multiple theories. One is because even if you see, if you look at the early images of ICG images of CNVM, you will see this halo. So what happens is, most of the blood is sequestered within the CNVM complex. So you don't see much, there's not much blood flow happening over there, and that is the reason you see this halo. Or there could also be another possibility that there's a much very turbulent blood flow around the CNVM, and that is the reason it's not picked up in OCTA. So you always have to look for this halo. If you see this halo, keep an activity, be suspicious that the CNVM is active. Next is the cross-sectional OCT. So what happens is, like I said, we always go on the face value. We just look at the emphase images. Make sure that you also look at the cross-sectional OCT. What happens is, all these OCTs, there's something called as flow analysis. So you look at the emphase image, you can see a good CNVM complex, and on the flow analysis, you can see the blood flow there. So that actually indicates there's a blood flow. So it means that this lesion is active. Now, it is not just you can not just pick up type 1 and type 2 CNVM. You can also diagnose type 3 CNVMs with OCTA. Now, if you look at, I don't have to go into the slabs, which I hope Dr. Jodi has already taken over. So this is the superficial plexus, this is the deep plexus, and this is the avascular segment. In the superficial plexus, you can see the circled region. You can see the CNVM network over here. You can see it in the deep plexus, and you can see also in the avascular slab. So this is the emphase image. Now, if you look at the cross-sectional OCT, you can see the flow through the entire retina. So that means this is you're dealing with a case of type 2 CNVM. This is another image of type 2 CNVM. You can see the deep plexus in the deep capillary plexus. You can see the CNVM network, and in the OCTA, in the cross-sectional OCT, you can see the flow in the entire segment of the retina. So, what happens with the CNVM in OCTA with treatment? So this is an image of OCT NFAS image, and you can see the structural OCT where you can see the CNVM network. Now, after injection, what happens is the anastomosis and loops, they reduce. The number of capillaries that you see, they kind of shrink down. Okay, the size of the lesion is almost the same. After that, the size of the lesion starts reducing, and finally, what happens is the entire immature membranes kind of get kicked out, and you only have you're left with the mature membranes, mature vessels, and that is how you see a scar tissue happening over there. So our purpose in this instruction course is like basically once you go back to your clinic, you should be able to see how to go about reading an OCTA. So I always prefer, like, it is not just imperative you look at the NFAS value, NFAS image and the cross-sectional OCT. You should also look at the structural OCT. It has a very paramount importance. So this structural OCT shows a fibrovascular PED. It's a case of basically a CNVM. Now, you first look at the superficial plexus. Now, in the superficial plexus looks very much apparently normal. Now, the deep plexus, you can see some kind of activity happening over here. Now, this could be either a type 2 CNVM or probably, it might be a projection artifact. Then you look at the avascular slab, you will see a well-formed membrane over here. And in the choriocapillaris slab, you can see the CNVM over here with the perilesional halo. So that's how you go about a case. So you see the structures OCT, you get the NFAS image, and you go through each segment. And then finally, to top it all, you have to go look at the flow analysis. So in this, we were little doubtful whether it's a type of whether it's a type 3 CNVM or a normal type 1 type of CNVM. So you look at the cross-section flow analysis, you will see most of this blood flow is within the RP, below the RP, and there is hardly any blood flow above the RP. So this is a basically case of typical macular neovascularization and not a type 3 RAP. So whenever you look at all this, OCT images, you should be cautious, because now if I look at this NFAS image, I'm very sure most of us will say, oh, there's a very beautiful looking CNVM over here. But if you compare it with the structural OCT, what you'll realize is this region where you see the network, there's hardly any RP. The RP has been completely denuded over there. So that is why what happens is increased amount of light transmission happens, and you see picked up much more signals. So what you're seeing as a CNVM over here, this is not CNVM. Basically, it's the choroidal vessels. Also, in this image, you'll see, if you look at the NFAS image, you will see some kind of a membrane forming over here. And in the choriocapillaris segment, this is a vascular slab. Okay, and if you look at the choriocapillaris slab, you can see something like a perilesional halo. But if you compare it with what segment the scan was taken, you'll realize that basically there's a drusen over here. There's no activity. And what you're seeing in the blood vessels is basically projection artifact. And the halo that you're seeing over here is the shadow because of the drusen. So my take-home message is, can OCT replace FFA? At this moment, it is debatable. But by probably the 60th or 70th drishti, we might be talking about, FFA being obsolete. Look at the NFAS image and cross-sectional OCT always. Don't just go on the face value. Always, it's a good thing, compare it with structural OCTs and beware of artifacts. Thank you.
Thank you for completing on time. And